Hi, good morning, everybody. This is Ryan Eldridge with Charter School Capital. We're just waiting for a few more people to log on, and we'll start the presentation in about 2 minutes. So if you can just hold tight, we'll get going right away. Thank you. Good morning, everybody. We appreciate you joining us on this Tuesday morning for our Charter School Capital webinar series. This one in particular is going to be focusing on Medicaid billing program. And I have a couple other partners in the room with me as well that will be discussing the Medicaid billing program, which is something we started at Charter School Capital a couple of years ago based on a lot of requests that we were having from customers of ours around the country, asking and inquiring about how they can get some support or some insight into how to do a better job or more effective job on collecting or being reimbursed for some of the Medicaid billing that they have. So with that, I'm going to jump into the next slide. We'll try to make this, it's scheduled for an hour. I don't think we're going to take an hour. I think with that, we'll have probably about a half an hour that we can get through all of this, with the idea that maybe at the last 20, 30 minutes, we'll leave for a question session at the end. We'll cover real quickly the background on Charter School Capital and also PCG, our national partner, the value of the Medicaid billing system, the platform and the process, and then, as I said before, we can save the end just for some quick questions. If people have that, we can do some follow-up later. As I get on to here, my name is Ryan Eldridge. I'm a senior new business specialist for Charter School Capital. I've been with the company for about 6 years now. My primary markets that I focus on are in California and the Texas markets. And I'm also joined here at Charter School Capital by Rich Collins. Rich.
Hey, how's it going? My name is Rich Collins. I'm the product specialist here at Charter School Capital for Medicaid billing, and helped kick off the program and the partnership between us and public consulting group PCG about a year or so ago. So excited to talk to you about the value that we think this program can bring, and how our platform can be a good fit for you guys.
And then we're also joined by Rose from PCG. Rose, you want to introduce yourself? Say hello.
Yes, welcome everybody. My name is Rose Jensen. I'm with PCG. I've been with PCG for 4.5 years. I've been primarily focused on school Medicaid reimbursement programs throughout the West, specifically Colorado, Arizona, and California.
Nice. Well, thank you for joining us today. From a charter school capital overview, just so you guys know who we are, if you haven't worked with us previously or know who we are, we've been around for over 12 years serving charter schools nationally. That is our focus, 100% of our focus. We don't dabble in the charter school space. It is our entire business model. What we're trying to do is provide the resources that charter schools need to thrive. In essence, what that typically comes down to is we are a financial company. We provide startup capital, growth capital, bridge financing. We also have facilities financing. We currently support over 42 properties and schools around the country, and we manage those properties. That includes acquisition, tenant improvements, and ongoing maintenance of those properties. We've served over 1 million students during that time. That's a cumulative amount of students that we've served. Again, we are a national platform, and that's about 700 charter schools that we've helped across the country. It's about $2 billion in funding, and we're based out of Portland, Oregon. This is where the headquarters is. We get about 60 employees here. We also have people that are out in the field and based around the country, several people in California that actually reside and live in California as well. And so we've had a pretty good track record with both schools and the investors that we serve. So on the PCG side, Rose, you want to talk about PCG a little bit?
Yeah, absolutely. Thanks. PCG is a privately held company. We are headquartered out of Boston, Massachusetts, but as you can see from the map, we have local presence throughout the country. We do hold educational contracts in all 50 states. And specifically in California, we have a good handful of offices represented in both Northern and Southern California. So we do have a lot of relationships with throughout the country with each state Medicaid agency where we have school reimbursement programs. And just
nice.
To add a little to that, yeah, I want to note that specifically for school Medicaid-based programs, we've helped schools recover over $6 billion, and just in 17 and 18 alone, over $500 million in Medicaid claims submitted. So our relationships run pretty deep with state Medicaid agencies throughout the U.S.
Yeah, that's great. And the fact that you guys also partner with some of the largest school districts in the country, which is where these charter schools are actually residing oftentimes. So I think that's a key point as well. So, well, we're excited to have you, Rose. We appreciate you being here. I'm going to move on and basically just touch on the value of the Medicaid reimbursements first off. This is an area where, I would say the proxy would be, for the schools would be the free and reduced lunch numbers of students they're serving currently. And as you look at that population of students in your school, there's also the other component, which would be those with, an IEP, that you can start to get an assessment of the number of students you might be serving that would qualify for Medicaid. With right here on this slide here, some of the requiring health-related services, are speech therapy, counseling services, occupational therapy, physical therapy, nursing services. My understanding too, and Rose, you can correct me if I'm wrong, is that there will be potentially additional services that will be included in this in the future, which might actually expand the number of students that would qualify for Medicaid down the road. Is that correct?
Yes,
Sorry.
absolutely.
Yeah. Okay, cool.
Yeah,
we'll
with
touch
the
more on
extension
that.
of free care services. Yeah.
Yeah, free care services. Very good. Yeah, and I'll turn this over to you in a bit too, where you can actually talk more in depth about it. But as the services increase, it's becoming more and more of an arduous process of actually making sure that not only are you doing it properly, there's always that case that you could be audited for, some of the information that you submit when applying for Medicaid. But just the sheer fact that it's cumbersome. You have you need staff on hand that are qualified to be able to handle the processing of the paperwork, the reporting capabilities, and with that, it takes some full-time attention, and a lot of schools may or may not have those resources on hand. And with that, this is why it's important to have people that you can partner with that actually focus on this 100% of their time and know exactly what they're doing and what the changes in the regulations are. So the biggest part of it too is that a lot of these schools, you're already spending this money, and you're already spending out-of-pocket services. In fact, I talked to a school in California just recently that it's spending well over $1 million a year in providing services to their students and they're really not recouping any of this money. And that's just sheer out-of-pocket expenses with no reimbursement whatsoever. And it's becoming an issue that they're starting to focus on a lot more. And the reason being is that they feel that they could be recouping a lot of those costs, or potentially recouping a lot of those costs, if they were to do focus or spend some kind of time and have some kind of process to do this. And so this could apply to you out there. Not quite sure who exactly is on the line, but we can talk more offline if there's interest afterwards, but we'll get into this here now. So, Rich, one of the things we've talked about before is the qualifying students. So first off, again, the proxy being is the free and reduced lunch numbers is the largest population that you should first look at. Is that correct?
Yeah, so this is sort of our quick framework for how to think about what the total potential reimbursements could be. So the first point, or the first piece here, is to identify the intersection here of both students that qualify for Medicaid and then the services that are being sort of provided to those students, and if those qualify for Medicaid reimbursement. So where there is overlap, that is where there's opportunity for Medicaid reimbursements. So the typical, if we're just thinking about the statewide average, it's probably between 10 and 15% of your total student population probably falls into that intersection there of qualifying services and qualifying students. So a good proxy for qualifying students, if you don't know that the student is on Medicaid, it would be free and reduced lunch or free lunch. The number of students that are on free and reduced lunch, and the number of students or the percent of your population that's say has IEPs, you could put those two numbers together, and you would get a good proxy for how many students you could bill back from Medicaid. Again, this is about 10 to 15% on average, but some students or some schools have a focus specifically on special education, so their population might be higher. Some schools might have a greater population of free and reduced lunch students. Again, that would make this higher for those schools. And the average for California is about $400 per student that qualifies and has these services provided to them. So you would take your population, you would say you have, let's go to an example actually. So if you actually had 300, this is an example of 300 qualifying students in year one, it can add up. So $400 per student that's billing. This is just an annual look. The bars are the annual figure of how much the gross billing or reimbursement you would get would be, and then the light blue line is the cumulative over 10 years. So it's something that we think it's good to get this system in place so that you can recoup costs over the long run, and that you can have it in place to sort of have this annuity stream to reimburse you for the services that you're already providing. So in this example, over 5 years, it's about $700,000 of gross billings cumulatively over that time period and nearly $1.5 to $2 million over 10 years of cumulative gross billings just for getting this program in place. So I think we could flip to talk about our platform and kind of the process, and I'll kick it back over to Rose to talk about that.
Thanks, Rich. Yeah, what you guys are looking at here is basically a 3-layered approach to recouping those costs for your charter. So that top layer there is where the charter plays a role in identifying students that need services, and then of course employing the providers that deliver the service, and then the ongoing service documentation in the form of usually like service logs, things of that nature. So hopefully charters are already doing this. It is the law to be compliant here. What we find bringing new charters or school districts on is that these things usually are taking place, but they're not necessarily streamlined or housed by the same group of folks. It could be a little bit disorganized without the streamlined process. So that's where the middle layer there comes in with the PCG platform. That's where we collect the data on the students, on the providers, including the service logs. So we would collect that from the charter, and then we're able to, because of our relationships, our long existing relationships with the state Medicaid agency, in California's case it's DHCS, we would then submit billing through the information provided to us from the charter along to the state Medicaid agency, in which case they would review and approve claims and send reimbursement directly back to the charter. So it's quite a cyclical process, depending on your school needs or however we would set up the whole process to begin. We could possibly do a reimbursement cycle of, say, claiming once a month. We could do a claiming cycle of once a quarter, just sort of based on the type of data we have coming in from the charter, the amount of billing we have.
Any questions?
Yeah.
Okay.
And I'm sorry, did you want me to, I can keep going.
No, I was just saying, I'll switch screen. I wanted to make sure you were ready to switch screens here, so we can talk about the building services platform.
Perfect, thank you. So yeah, what you're looking at here are a couple of snippets straight from our application in the PCG platform. And the top page is just sort of showing you that on our homepage we have dashboards with this particular example of service monthly logs. We have a calendar where providers can go in and click on certain days and log services directly from there. It's a very intuitive system. We also have on the homepage down at the bottom a place where providers that may encounter some issues or questions can email us directly. We do have a team that would be working for your charter, a dedicated team that would be monitoring that correspondence with the email, as well as we have a help desk line. And then the bottom picture on that slide is an example of what it would look like when a provider wants to log into, or I should say, search for a student to log services. It's as easy as finding or selecting the service date, entering the progress, picking a procedure code to apply to it. So that would be maybe either an evaluation or maybe a group therapy, typing in a note and hitting submit. And really logging services is that easy. Like I was saying, it's a very intuitive application. And we've worked with many districts using this application, over 1,400 across 26 states of charters. So we've gotten a lot of feedback and made a lot of progress with this application. And I'll turn over to you, Ryan or Rich, if you wanted to add.
Yeah, no, this is great. In fact, when we talk about the schools, oftentimes it's, thinking about it in real real world situations, how this might be beneficial to them. You know, one of the situations that I know a school had actually had an issue on was being questioned on the number of hours that were being billed and the services provided to their students by a parent. You know, so for instance, the parents came in and questioned the number of hours that the kid was actually receiving. And I think it was a situation that you explained to us where the school was easily able to pull up these reports and show exactly when and where and how many hours were the student was serviced for, and be able to show this very clearly to the parents to put them at ease and making sure that they understood that the kids were being served properly.
Yes, that's exactly right. That's a great example. We had that situation in California where our administrator at that site was able to pull it up and say, well, you're right, that the kid didn't have X amount of services logged because your child was actually absent on these 5 days, which didn't allow us to meet those service logs. And so, I mean, it was proof right there. So that is a something that can keep schools out of unnecessary litigation, because it is the law that if they have these services prescribed in an IEP, that the schools are delivering them. And another thing we heard as far as feedback from schools is that sometimes, they contract their providers. So let's say they have contracted speech language pathologists, and they get invoiced, let's say on a monthly basis, as to the hours that those providers are servicing students, and they have no oversight as to if that actually took place. And in our system, when you have a provider that sees students, they're logging all the services. So, with the click of a button in a report per provider, you can see the actions they've taken in the system and the services they've logged, and you can potentially sort of compare an invoice to maybe the services logged, and do sort of a true up on what they're billing for and what they're delivering, or it can just add that extra layer of oversight.
Yeah, I could see how that would be very helpful, providing comparative cost analysis as well for the vendors that you're using or the service providers you're using. In addition, I would think a more uniform system of service providers all kind of being on the same system as reports come in versus getting variable reporting mechanisms, whether it's Excel or a Word document or something else that you have to on your end then process. So from a streamline and efficiency standpoint, it does create a clearer system all around for the school and its operations. I'm going to shift over here. Okay, so some of the key features, if you just want to kind of touch back on here, it's, providing the online service documentation tool, from a collection standpoint. They can do it on mobile devices or computers, and the signatures are electronic, which is great from the parents using EdPlan Connect. The idea being is that today trying to get wet signatures and emails back and forth can be pretty cumbersome, so the electronic signatures really streamlines things. Do you want to touch on the multi-layer claiming quality control process?
Yeah, absolutely. So as your sort of go-between, if you will, with the Medicaid agency, the HCS, and your charter, we stay on top of the procedure code changes, updates, which happen almost annually, rates at which services are paid, and things of that nature, because it's really important that not just that we recoup the money and get that sent to you for charters themselves, but also that you get to keep the money that we do help you recoup. That's very important. So compliance becomes a very important thing that PCG has a great focus on. Like I showed you on the map earlier, we have a presence in all 50 states and a good couple of handfuls of school reimbursement programs throughout maybe 12, 15 states that we really work closely with those agencies, California being one of them. So we have a very high focus on compliance because it really does charters no good to receive money that they might have to then return based on, non-compliance with the state and federal Medicaid agencies. So we do a lot of quality control internal, which wasn't really captured in the one slide with the 3 layers, just because we're trying to keep it very high level. But within that layer between PCG and the state Medicaid agency, we go through many quality control procedures that help us really only submit claims for services that are appropriate and compliant with the law.
And that should help with streamlining your budget, that when you receive the reimbursement that you're not having to give anything back. And we know in California especially, just the school funding model in general of having true-ups and having sort of a imbalanced budget throughout the year on a monthly basis. We know how challenging that can be for schools. So this is a great way to help kind of streamline that and have predictable reimbursements come in on a regular basis.
Yeah, that sounds like it would be very frustrating to receive money and then have to give it back. My question, I guess, a follow-up question on that is, Rose, how often do the laws change? How often, do code requirements change? Is it a yearly basis or biannually? What are you seeing out there?
Yeah, I would say probably on an annual basis. They update procedure codes and pay rates. And that is important because, you miss those and you're not up to date on them. You don't have that ongoing relationship with the Medicaid agency, then those can go unnoticed, and you find out you've been claiming and getting paid for services that are no longer covered. Could be a big problem. And maybe it's only 3 months or 4 months or 5 months, but that does add up as you continue to receive that reimbursement. So we do stay on top of that. We get all the feeds and we join all the calls that we're involved in. Not just we're involved with DHCS, not just for claiming, but with other programs as well. So we have a pretty good, well-rounded idea of when changes are coming and when they're going to be implemented, and we proactively communicate, if need be, with the charters on any procedures that they may have to do different going forward.
Yeah, that's great. I know it's a challenge for a lot of charters out there being under-resourced in the sense that a lot of people are wearing a lot of hats in the organization as it stands. So to have somebody focused on the changes that could be coming down is really helpful. We discussed the reporting. You showed the reporting screens, showing the gaps, or at least, even the real quick analysis of where things stand on a billing and how you might compare different vendors or service providers. So the training resources and support to support your staff, this is talking about, obviously, I'm assuming as we move forward, and if you were to come on board with a PCG or start to implement this system, that you would provide online training for the actual school staff that's handling the programs. Is that correct?
Yeah, typically we like to do an in-person training to get everybody started off on the right foot. We do a system demonstration right there. Everybody can see how to log services. It's like I said earlier, it's very intuitive for the user. So, and then of course ongoing, we do have support. So, like I mentioned, in the system itself, it's they log in, they're there. They have a question, they can email it directly from that homepage to us, and we have project people checking those daily. So we respond right back there in the system. And then, of course, we have a helpline that you can always call if you just need to get somebody on the phone. Sometimes that's easier than dealing through email as well. So we do offer that ongoing.
Great. Well, I think that covers the key features as well. As far as any additional information. First, I do want to open up and just check real quick to see if anybody had any questions. And right now, it doesn't look like we do have any questions. So hopefully that means we answered all the questions people may have had. But at the same time, if there is additional information you'd like to learn about what Charter School Capital and PCG have to offer regarding Medicaid reimbursement, we'd love to talk to you further. It's always easier to do it as a kind of individual situation. There's a lot of variables that go on to student populations that you're serving, and kind of where you are in the process, and are you, in a midway point or a starting point. So feel free to contact us. My email address is up there. And if you would like to set up an appointment just to discuss, I guess the next steps, how we would handle it is probably a readiness assessment. And so the readiness assessment is just filling out a form. It's probably about a 2-page form with a bunch of questions asking about the school and how your current program is set up and the student populations you serve and the services you're providing. From there, we can get a basic assessment, at least a ballpark number of how many we think would qualify for Medicaid reimbursement, and then be able to discuss potentially, what the, potential returns might look like for your school, and go from there. So other than that, since we don't have any questions, I think we are done here, and we're going to give you back the rest of your morning. Rich, thank you. I appreciate you joining me this morning.
Right.
And Rose, thank you very much for joining us. We appreciate the opportunity to speak with you again today. And thank you all for joining.
Thanks for having me.
Yeah, absolutely. Thanks for joining today, guys. And that is it for the webinar today.